Bubble wrap or not to bubble wrap? That is the question. Whether 'tis nobler to mind their suffering, the slings and vet wrap of an outrageous future, or take to legs against a sea of troubles, and by opposing to allowed wounds, to cut, to bleed, no more, and by a bubble wrap we say, end the skin ache and the thousand natural shocks that their flesh is heir to. Hi, I'm Michelle Intruder. You can probably tell I'm a theater kid, but more importantly, I'm a horse owner. So I know firsthand that we want to die at the thought of losing them, like Juliet, our Romeos. So anytime any little thing happens to them, it really does feel like a Shakespearean tragedy, but it doesn't have to. So spare the bubble wrap, yes, even for that one mare that's always getting hurt, as we explore what wounds really mean for you and your horse. Today we'll talk about some parts of the skin, some types of wounds, how they heal, and how to take care of them. It's nice to know the parts of the skin, as skin is a lot more than what it looks like, and it's helpful to understand injuries by understanding where they happen. The skin is the largest organ in any mammal's body and is important. Not only does it physically protect and hold structure, it is an immune barrier. The epidermis is the top layer of skin and is your horse's first line of defense against any issue with the immune system. What you can see of the epidermis is all new or dead cells as cells move from the subcutaneous up, and this is home to hair shafts, which are obviously a lot more abundant in the horse than the human. This is 0.053 millimeters thick. The middle layer is the thickest, the dermis, which is 1 to 6 millimeters thick, depending on where they are in the body. The dermis is so big that it's actually broken down into 2 sublayers. The dermis is home to sweat glands, hair follicles, nerves, blood vessels, and has smooth muscles and even a third sublayers in some area. Finally, we have the subcutaneous. The subcutaneous is the bottom layer. This is where you find your fat and twitch muscles. Twitch muscles, like their name suggests, are the muscles that move the skin, or twitch, like when a fly lands on a horse. Your subcutaneous is kind of elastic, stretchy material, so it can connect skin to other deeper structures such as bone and muscle. The subcutaneous is also, not only does it protect against diseases, it physically protects sex and absorbs shock. Now that we know where wounds happen, let's talk about some different types of wounds. Like any medical problem, there are several variations. Alphabetically, first we have abrasions. Abrasions are when any skin is rubbed off in any way. So it's normally kind of rough like sandpaper, no definite edge. And since it's just skin rubbed off, this usually affects only the dermis and parts of the epidermis. And sometimes abrasions don't even bleed. Abrasions are caused from rubbing against something, like when you fall and scrape your leg. Because of how unsevere abrasions are, you normally don't need to call your vet. The thing that tends to scare horse owners about abrasions is their length rather than their depth. Avulsions are scary for sure. Avulsions is also when skin is removed, but this is when skin is just peeled off, like categorized by like a flap. When avulsions are severe, they're very severe. So if you think you should call your vet, you probably should. An avulsion affects all 3 layers of skin, just completely taking the skin away down to bone and less muscle. In these severe cases, it is called degloving. Contusions are more common, also known as bruising. You're probably familiar with them. They especially happen in the horse's hoof. Contusions are different than most wounds as they're caused by impact, and although the blood vessels might rupture, the skin doesn't, causing blood to pool under the skin. You normally don't need to call the vet for this unless it's a true hematoma, which is when there's so much blood pooling that not only does it pool under the skin, it begins to pool into the muscles too. A laceration is very common, and depending on whether it's a vein or an artery and how thick it is, determines whether you need a vet or not. Lacerations are thin, jagged edged, and are from something cutting it. It's what you think of when you think of a cut. This can be something as minor as a paper cut, but can be a lot more. One type of laceration is an incision. An incision is a surgical wound that a doctor or a vet would use to cut their vet open, so these are very straight, clean edged. Obviously, with an incision, a vet would give you post-op instructions as to what to look for. To me, the scariest type of wound is called a puncture. A puncture is what does the name suggest? Whenever something somehow penetrates the skin. A puncture wound is circular and deep, because it's a stab. Puncture wounds are always caused by foreign objects. It can be something as small as, an injection for a vaccine or stepping on an earring, but isn't always. If the foreign object stays in the puncture wound, which sometimes it does, please don't remove it. This is extremely dangerous for several reasons. One reason is that the foreign object is holding the correct pressure to the wound, and if you remove it, that would cause your horse to bleed out with no medical attention, and also it would leave a literal open gap in your horse. So that's asking for bacteria and viruses and infection to happen. Also, you never know what a puncture wound is. The object is affecting. In the leg, you could be severely damaging the musculoskeletal system, and in the abdomen, you never know without imaging or extensive knowledge of anatomy what organs you could be destroying, especially in the chest. In the chest, there's actually an empty pouch around the lungs, and when this empty pouch is punctured, which means there's a hole in it, air gets into this pouch. Air causes pressure, so lungs can't expand. So if you remove a puncture wound, if you remove an object, your horse may literally not be able to breathe. Now, like anything, healing is a process. Let's look at some of the steps. The first step is called hemostasis. This happens immediately. The wound is closed by blood clotting, hence why you hold pressure on a wound to aid with the vessels sticking to themselves. After the vessels stick to themselves, this isn't strong enough to hold, so platelets bond within seconds to cover the gap. Platelets are found in blood. Fibrins coagulate, which means that they go from a liquid to a solid phase to reinforce the platelet bond. This all that happens very quickly within a minute and is important for all wounds. Here are some examples of a wound in the hemostasis phase. These are all examples on me, as skin is easier to see a wound on than fur. This is from scraping my knee and abrasion. These are all actually abrasions. This is a bunny scratch, and this was from shaving. The inflammatory phase is next. Inflammation simply means swelling. The word swelling scares people as it's associated with the itises. Itises are conditions of which something you don't want swelling is swollen, like appendicitis, but swelling is completely normal and nothing to worry about. In a wound. Swelling controls bleeding and infection. You can tell that a wound is in inflammatory phase because of the presence of redness and a scab. This also begins to happen immediately, like hemostasis. So blood vessels locally leak transudate, which is a protein made up of water and salt, and it's a reaction to the transudate which is why redness occurs. So fluids begin to build up, which is a positive thing, as this is how white blood cells get to the wound to heal it, and this is also how damaged cells and bacteria and other unwanted microscopic things are expelled from the wound. A little bit of pus is normal to see in the inflammatory stage. Pus, yes, technically is a sign of infection, but with wounds, they almost always have some form of infection. So if you pull a bandage off and you see a little bit of white or yellow cream, don't worry. With excessive swelling or excessive pus, that's when you need to worry about an infection. Here is an example of more cuts. These are lacerations. This one was from a can. You can see that they're red, and you can see that they're kind of discolored because of a scab. Here's an abrasion. This is an example of a very mild avulsion technically, as you can kind of see where the skin was peeled off. This is a very great example of a scab. You can see that as the days progress, the scab kind of changes. Now we go to the proliferative stage. This is when the wound begins proliferate. The wound is rebuilt from new tissue. A protein called collagen, an extracellular matrix, begin to go to the site of the injury. The wound begins to contract, which means the two sides of it begin to move together from these things called myofibrils, which are little proteins that pull the wound together. And new blood vessels begin to be constructed. Epithelial cells, which are cells found in skin and the lining of all organs, begin to resurface too. In the proliferative stage, moisture is important as fluids are needed, and granulation tissue occurs. Granulation tissue is little balls found in a wound made up of flesh and arteries, and sometimes look intimidating. They're supposed to be pinkish, but when they're red or excessive, which is called proud flesh, which means that it's completely exiting the wound and out of control, that's when you need to worry. Here's some example of the proliferative stage. This cut right here is a really great example of healthy granulation tissue.